What is up, everybody? Welcome back to Eclectic Beard Reactions. This go round got USA versus UK healthcare, and I'm just going to put this out there right off the rip. While it's cool to be able to take and have health insurance and stuff like that here in the US, the issue is the cost regardless, and the fact that you can spend your entire savings and bankrupt yourself making sure you pay your medical bills. The other thing is, I think Obama had a great idea, but it was an aborted attempt. So everybody's insurance premiums rose, and even those who got the free health care with the stimulus from the government had to wind up paying back any kind of earned income credit. They were already low income. A lot of times with taxes, that earned income credit or child tax credit is what helps offset stuff throughout the year. So we've got a messed up system completely. So I figured it's about time to take a look. And after this video right here, we're actually going to take a look at another video and British people finding out about the U.S. healthcare system. I figure it's probably going to be interesting. Like, because if I think it's messed up, I can only think what somebody from outside of our country is thinking about it. So, yeah, before we go any further, like, subscribe, notification bell. Let's go ahead and get into it.
Healthcare systems cannot be more different when we compare the United States and the United Kingdom. The United States has the largest private sector system, while the United Kingdom has one of the largest public sector systems. Both systems are highly respected and have world-class health outcomes. But the UK healthcare, otherwise known as the National Health Services (NHS), has way fewer health outcomes variation across its population when compared to the US. If you want to discover the main differences between both systems,
well, I can only imagine part of that's due to the fact that the money factor. In the US, you've got the hospitals, you've got the doctors, and you got Big Pharma all in bed with each other. So Big Pharma takes and gives kickbacks to doctors and hospitals so yeah, I'm sure that, you run across on the day when they're pushing something that your body's not going to react greatly to. Yeah. Anyways, that's neither here nor there.
Make sure that you stick around to the end of this video. Healthcare in the US is almost exclusive by private sector providers. Hospitals are owned by either for-profit or non-profit organizations. Most of the people in the US have access to healthcare through a blend of private health insurance, Medicare, and Medicaid programs. Medicare is a federal program.
No, there's no blend. Like, unless you're older, that's when you have the blend. That person on the video right there, where it shows white hair, yeah, that's when you have access to the private and then Medicaid and stuff like that. Otherwise, like, you don't have access to Medicaid or the Medicare or Medicaid system if you have the private health insurance, unless you're like extremely low income, at which point you're going to be on Medicare anyways.
Program that provides health coverage if you are 65 years or older, no matter what income you have. Medicare also provides coverage for people with disabilities, even if they are under 65 years old. Medicaid, on the other hand, is a state and federal program that...
Medicaid, then Medicare. Medicare is if you're older. I get them mixed up only because, well, they both basically serve the same function, other than Medicare being just for old folks.
Provides health coverage if you have a very low income and cannot cover your healthcare costs by yourself. The remaining people who are not covered by private insurance, Medicare, or Medicaid will have to rely on their own financial resources to cover their health and medicine expenses.
And let me just say this, because even this, I know people like single moms and stuff like that who fall up underneath the poverty level, but yet, because the income they earn, even being as low as it is. I know people, and I also know people who have been homeless and stuff like they don't have access to Medicaid. So there's already fallacies in this. they take and talk it up like, oh yeah, it's there for people who, no, it doesn't freaking work like that at all. Like, there are so many people I know that, like, were at one point in time making criminal amounts of, like, just underpaid. Like, they weren't hardly getting any kind of money. They're single parents and stuff like that. And deadbeat dads and everything. And they couldn't get Medicaid because the job they made, the job they worked at, or the jobs they worked at, brought in enough income to disqualify them for Medicaid. The kids could get Medicaid, it's only because they were younger and everything else like that. So that's one perk. But the person themselves, they weren't able to take and get it because they were bringing in enough income to disqualify them, but yet they were still up underneath the poverty line.
The United Kingdom healthcare system, otherwise known as the National Health Services, NHS, is an ideal example of socialized medicine and a single-payer healthcare system. This means that healthcare is provided by a single payer, which is the British government, and is funded by taxpayers of the United Kingdom. The appointments and treatments are provided for free to patients, as are most of the prescription drugs. Well, let's re-emphasize that it's paid by taxes, so it's not truly free. But the NHS...
Yeah, but even being paid by taxes, I mean, at least there's that, you know, you've... you want to talk about a rant, I could go on a rant, because we could do the same thing. But no, our military is too important, because we have to be the world's police force.
NHS is not entirely free. There are some services that require patients to pay, such as dental and eye care, but the fees are comparably low to the US fees. The maximum cost of receiving any drug prescribed by the NHS is $12. The United Kingdom does allow employers to offer...
The maximum cost, $12. Bruh. You can't get a fucking EpiPen in this country, but yet the fucking meth heads and shit like that can get fucking Narcan for free as many times as they fucking overdose. But fucking 6-year-old Johnny and Jill over here, their parents have to take and mortgage their fucking house and basically sell their left nut to take and afford an EpiPen. $12 fucking dollars? Are you shitting me? That is absolutely... God damn, we've got stuff so fucked up over here.
Private health insurance plans to workers. Some of these workers decide to opt out of the NHS and receive their medical treatments privately. It is quite an advantage as private patients choose their specialists, unlike NHS patients. Private patients also avoid waiting lists for non-emergency procedures, while NHS patients tend to wait for weeks or even months. When it comes to accessibility, NHS patients receive their primary care from general practitioners, which are referred to as GPs, who act as gatekeepers for secondary care. When it comes to accessibility based on age, the National Institute for Health and Care Excellence, otherwise known as NICE, consults Citizens Council to help it sort through difficult ethical issues such as prioritization of patients based on age, which is simply not allowed in the UK. Patients of all ages should receive the same degree of access to the healthcare system. Now let's compare the US and UK healthcare system. The United States spends more on healthcare than any other country. When compared to the United Kingdom, the expenditures of the US healthcare system are approximately double the expenditures of healthcare system in the UK. It is worth mentioning that the United Kingdom's NHS services have a low cost when compared to other developed nations, according to the World Health Organization. UK spends around $4,000 per person, while the US spends $10,500 per person. That means that the United Kingdom spends around 9.8% of its GDP on healthcare, while the US spends 16.9%. That's a huge difference. But wait, there is always a trade-off for a low cost. The NHS is known for slow responsiveness time. When compared to the US healthcare system, which ranks as number 1 for responsiveness according to the World Health Organization. The US healthcare system is responsible for populations' wants and needs. The UK healthcare is financially constrained, which will result in wants to be constrained. This is seen in the form of a long waiting list for non-essential medical care.
But see, that's the thing. Non-essential medical care. Non-essential. Which means it's not life-threatening. It's not something that has to be done right away. Here, I broke my hip when I was 25 years old. No insurance, nothing. $70,000. $70,000. That's not including the $7,000 ride in the ambulance. It's not including the fucking, what was it? About $700 I took and paid for the medication, and not including another about 10 grand on top of that I was supposed to be coming out of pocket for physical therapy afterwards. So,
which is required by people in the UK, and obviously this is met by long waiting times. NHS patients wait an average of about 8 weeks for treatments that require admission to a hospital, 4 weeks for outpatient treatments, and 2 weeks for diagnostic tests. When it comes to life expectancy and infant mortality, the UK has a better ranking than the US. UK citizens have a longer life expectancy and lower infant mortality. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. The UK has a more acute care hospital beds per capita, and fewer deaths related to surgical or medical mishaps. So you can clearly see how both healthcare systems are different from each other. They both have pros and cons, since they follow completely different philosophies. Tell us what you think about these different healthcare systems in the comments section, and which one do you support? If you like this video,
I'm just going to tell you right now, other than the cost, we have an awesome healthcare system. Other than the cost, it's a pretty decent healthcare system. How do I put this? Our government is more concerned, and there's still a good portion of the population. They hear a single-payer healthcare system, and first thing they think is socialism, while not taking a look around at all the shit we have because of social programs. It's nice to take and have social fallbacks for your society. Just saying, makes sense. Especially whenever, I don't know, you could have an even better one instead of spending $700, $800, $900 billion or $1 trillion a fucking year for your Department of Defense. Why? Because we've got over 1,000 bases worldwide. And for what reason? Because 80% of them are not even strategic. They're there, and that's it. So, let's go see what the British people think. Alright, so here we go. True cost of U.S. healthcare shocks the British public. Something tells me I'm going to be nonplussed with this.
10 grand! For a baby!
Is there a price for that?
Yes.
Jeez, $100? $200?
$2.5 grand.
$80.
600.
250.
More.
Shut the
Just at the jump off this, like, their reactions, I'm wondering what he's taking and saying, or what procedures and stuff he's talking about, because they're giving way low numbers compared to anything you'll take and get here in the U.S.
fridge.
More.
£300.
Double it.
$600. $600.
Yeah. Ambulance call out. How much do you think that costs?
Zero payment?
Zero payment?
Yeah, zero payment.
No. It costs $2,500.
For real?
Yeah.
Oh, okay, cool.
you look. An inhaler.
$100.
An inhaler. Now, there's different kinds of inhaler, but if you're talking about like an asthma inhaler or something like that.
Yeah, you're pretty close. It's a bit more.
120.
250 to 350.
For an inhaler?
Yeah. Well, see, the problem is here, Big Pharma is in bed with the doctors and with our government. They write the fucking law. So you get bullshit like this.
man. So if you're poor, you're dead.
I know that it's like public healthcare in the UK. In the US, fortunately, I'm able to get healthcare through my parents, their jobs, but like I carry an EpiPen, and I know that like the cost of that has just been rising. So like there's like very few companies that even compete, so it's sort of like a monopoly for the EpiPen.
Also, a fucking problem. Like 9-10 grand for those things now. Like it's fucking expensive. If I'm not mistaken, like it's somewhere like up there. Might not be 9-10 grand, but it's way more than it should be. It's a life-saving fucking device. It's a life-saving thing. You take a shot if you get stung by a fucking bee or wasp or some shit like that. But no.
Even though like we have insurance, it cost my parents about a couple hundred, even with insurance.
So 2 EpiPens.
Okay.
How much do you reckon they are?
$80.
600.
$40.
It's gone up since then. That's the reason why I'm saying it's like 2-3 grand for a fucking EpiPen now. Like it's fucking stupid.
I'm afraid not.
More?
More? 600.
$40.
I'm afraid not.
More?
More?
$100.
More.
$150.
More.
$250.
More.
Shut the fridge.
More.
£300.
Double it.
$600. What? Why?
That's a very good question.
When was this put out? Because I could be wrong, but yeah, I know it's like went astronomical. Yeah, it's so maybe not like 3 grand. I think it's around 2 grand for an EpiPen now. Like it's fucking stupid.
$600.
Yeah.
For me, it's more like just hives and shortness of breath.
Yeah.
So it wouldn't be like an immediate death situation, but like, so I've been fortunate I've not had to use it, but it's something like keep on me. Like I have my backpack right now, I have it on me.
Cost of childbirth.
Jesus. 50 grand, something ridiculous now?
Yeah, see, I've blown the figures up in your head now, haven't I? Because they're larger. It's the highest, generally speaking, is about 30 grand.
Okay.
Is that reasonable? You haven't?
Not reasonable at all. It's just like now we're on like we're on a benchmark.
100, 200.
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand for a baby.
Yeah. That's just the start of the cost. Yeah. Depends on whether you get shared room, private room, whether you do home childbirth, stuff like that. Like there's ways to cut the cost and everything like that, but still it's expensive as hell.
Well, I guess. How much is your child worth?
Yeah. Well, is that like the same everywhere?
Yeah, the average is about $10,000. Yeah.
That's mad. Oh, no thanks.
Okay, no thanks. In which case, the coil, IUD, contraception,
Yeah.
how much do you think that costs?
For one person
Yeah.
to implant $1 grand?
Yeah, a little bit higher.
Really?
Yeah, $1,300.
Oh. Mental.
I wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Is there a price for that?
Yes.
Jeez.
See, that's what gets me. That's what I find cool. They're asking, like, is there a price for that? Like, that's mind-blowing to me because we're not used to stuff like that. We're used to having to pay through the nose for healthcare-related stuff. That should tell you how fucked we are over here with some of our stuff.
$100, $200.
$2.5 grand.
For what? Why? Why?
Give birth by C-section,
Yeah.
and you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah. You have to pay to do that.
Yes.
To hold my own child that I've been carrying inside of my womb.
Say something else.
Yeah, I was.
But yes.
Jeez.
It's not actually that expensive.
Right. Charging me. I'm going to punch you.
Yeah.
Not you, but the doctor. Like $100.
$40
$40.
for skin-on-skin contact. What do you think of the NHS?
Literally the gift that keeps on giving. Literally. People are so dumb for taking advantage of it. And I don't want it to change.
Fun, does it make you grateful for the NHS?
Absolutely. I mean, I didn't know how much free healthcare we got like just off the bat, but like knowing you have to pay like 30 grand for a child, it's outrageous. It really is ridiculous.
Well said. Well said. It's ridiculous. 30 grand.
So, thank you, NHS, for your hard work.
I'm genuinely speechless.
Presumably you had an idea that healthcare was expensive in the US.
I didn't realise how expensive. Yeah, I'm just like, what? Like, if you don't have money, you're fudged. Yeah.
What do you think of the people who are profiting off the sale of these medicines?
You're bastards. Sorry, beep. I think, yeah, I think they should be stopped.
I'm going to disagree. Nothing wrong with making a profit, even off of something like medicine, because the research that goes into taking and doing making these medicines and stuff like that have life-saving abilities. You should be able to turn a profit, but you shouldn't be able to take and I say you should be able to take and turn like 1,000% profit off of something that you've taken in research for 30 fucking years or 10 years or 5 years. However, the problem is they wouldn't actually be profiting as much here in the US if, and this is a big if, our government wouldn't allow it to happen. But they don't give a shit. So, yeah, because, well, big pharma like Pfizer, Merck, all of them, they're in bed with our politicians. Like, our politicians should have patches for who's bought them, basically, over here. Be like NASCAR drivers. Like, oh, so he works for this, and this lobbyist, organization. Or at least that's whose lobbyist organizations got to him. That's legit how it should be here. We don't have people go, oh, we're a republic. That's horse shit. We're a corporatocracy at this point. An oligarchical corporatocracy at that.
Fuck Trump.
And there you have it. There you have it. So, yeah, we has issues. Granted, we do have access to good health care here. However, the problem is if you're poor, like I said with that first video, you're not gonna. It's already hard enough to take and live with being poor. You take and add healthcare costs, even if your kids are covered by Medicaid. Let's say you've got a kid, or you got 2 kids, you're a single parent, or even if you're a married couple, right? Let's say together, you and your wife, you've got 2 kids, combined, you make 40 grand a year. Or not even 40 grand. No, let's say you make 30 grand, because I've seen that. Well, you're just barely over the poverty line. However, you can't afford the insurance that your company provides, because you got to pay for that. Family of 4, there's a good chance you'll be paying $120 a week on that, so that's $480 a month. You're not gonna be able to afford that. But your kids are covered by Medicaid. But if something happens to you, not only do you miss out on the lost wages, but you are also even more financially fucked, because now you've got 2 years from now, 3 years from now, whenever you might have gotten your earned income credit, your child tax credit, because that's something that, depending on what tax bracket you're in, especially being poor, that helps. That really helps, because a lot of folks are able to take and catch up on stuff because of that, put some back, and then use it as needed throughout the year from whenever you've got shortfalls and stuff like that, paychecks because of unexpected things. Yeah, you no longer have that because they take it from you. State, federal, they take it. There's no reason why here in this country that people should take and work until they're 60, 62, 65 years old, and then have to take and run through the 401k after they've retired because they've got cancer. No fucking reason. So, I love living in this country, but I'm about tired of this. I'm about tired of the bullshit, or the way our politicians take and do. Because, I don't know, we could take and cut down probably 900 of the bases that we have worldwide. Take and bring a lot of that money back. We spend more than China and Russia. So, they're about $300 billion a year. We could go down to that level, not really lose anything whatsoever, and put it towards our healthcare system. But no. Big Pharma would lose out at that point, so can't have that. There you go. You got politics from me. Yeah, this is one of those subjects that I'm like, fit to be tied over. Y'all be good to each other. Love yourselves. Peace.